Welcome back to Careers and Coffee Talk. I'm your host, Laura. Today's guest is Mary Mastroianni, the Senior Director of Emergency Management at Boston Children's Hospital, and someone whose career journey shows exactly what it means to match passion, personality, and purpose with the right profession. Mary has responded to more than 200 hospital emergencies, from technology outages to mass casualty events. She played a critical role in the hospital's COVID-19 command center. Mary's presented nationally on pediatric emergency management, the Boston Marathon bombing response, coalition development, and more. But what I love about Mary's story is how she got here. A self-described crazy extrovert who started out in AmeriCorps, worked in wildland firefighting, and tried out different roles in healthcare and public health before she eventually found her calling in a hospital emergency management setting. In today's episode, Mary and I will talk about the winding road that brought her here, the lessons she's learned along the way, and her advice for anyone trying to figure out exactly where they want to go next. Let's get into it. Mary, I'm so glad to have you with us today. Thank you so much for joining me.
I'm so happy to be here. Thank you so much for having me.
Of course, yeah. First things first, this is Careers and Coffee Talk. So, do you have your coffee ready?
I do. I always
Awesome.
have coffee. And so
That's
I
awesome.
love to talk about coffee. So
Perfect. And what is in your cup? Are you black coffee drinker, hot, iced?
always black. And my
Okay.
favorite in the summer is a nice flavored iced coffee, which is
Mm.
divisive. Not a ton of people love flavored iced coffee, but especially in the summer, that's my go-to.
That's great. I'm a hot coffee drinker in the morning. I love an iced coffee in the afternoon in the summertime. It's like a great pick me up.
Definitely. That's definitely true.
Well, let's jump right into it. So, you're at Children's Hospital in Boston now, of course, but that's not obviously where you started. I think there were quite a few twists and turns to get to where you are now. But I want to rewind a little bit and go back to little Mary growing up. What did you want to be when you grew up?
Well, when I was in second grade for career day, I went as a speed skater, an Olympic speed skater. I had a a fake silver medal. I knew I couldn't be a
Love it.
gold medalist. So I was really going for silver. I'm very tall and always have been very tall, so I knew, figure skating, I couldn't do it. But at that point in time, I definitely wanted to be either a teacher or around kids in certain ways. So I ended up a little bit different than that, although I am around my own children frequently. So
Yes, yes, that makes sense. And you're child adjacent. There are children at your
yes,
work, although you may not work with them.
yes, I do see them, which is great.
That's great. Well, so and again, just going back to like as you first started out, right? Through your 20s, I think you mentioned, it's kind of time of for a lot of us, right? Like figuring out who we are, what we want, what kind of fills our proverbial cup. Take us through some of the twists and turns of your journey, how you got started and kind of what led you to where you are now.
Definitely. So I was a person who needed all of my 20s, every ounce of my 20s I needed to understand what I wanted to do, as well as who I was and how to fit that together. In college, I was a sociology, international studies, and Italian major, and I very much did not want to be in an office
Mm,
after graduation. I knew that. So I signed up for AmeriCorps after and
awesome.
joined a firefighting team. And really went all around the country with my team doing different jobs and different services, which was really important for me to understand what I liked and what I didn't like.
Hmm.
After that, I moved to Denver and worked on an adult day care program for seniors with memory loss. So I think that kind of started my interest in healthcare in different ways. I also
Sure.
got my EMT, and I realized both with my EMT and in firefighting, I didn't love like direct response.
Mm,
So we were on a really big fire when I was in wildland fire, and there were so many different fire teams together trying to battle this like acres large fire. And we were told, like, you've got to dig a a huge line around this town to try to save it, and we had to do force protection, all these things. But in my mind, I kept thinking, how does this fit together? How are all of these different teams working together to make sure that this fire is put out eventually, or at least contained? And so that kind of got me thinking in a different way. Same with EMT things, right? I really liked being around patients, but patient care, that detail oriented, giving shots, not something I'm
Not
wonderful
for you. Yeah.
at. So I kind of knew that about myself, and really kind of shifted and thought about, what does this mean? What kind of career could this be? And fell into emergency management. I really thought at that point in time that I would go global. And while I was in grad school at Tulane, I lived in Suriname for a while. I was in Haiti after the earthquakes for about
Okay.
4 months, and saw that international response in a certain way. And I thought, okay, I do like this, but I miss being around Americans. And it's different when you're in a country for a short amount of time, trying to change a lot. And that's when I shifted and got a job in Boston, through healthcare emergency management. And here I am today. So
Here you
it,
are.
yeah, it took a lot of different places. I've lived in like 9 different states, and it really took a lot for me to kind of figure out where I fit and where I
Yeah.
wanted to be as well.
Yeah, I love that you took the time to kind of figure out what you wanted, what you didn't want, what worked for you, what worked for your personality, kind of recognizing that about yourself and having these different experiences, from AmeriCorps, right, to wildland firefighting to EMT work and global public health. How did each of those experiences help shape the career path that you eventually took? Like, how did you end up where you are now exactly? Like, what was it about Children's Hospital that interested you in particular?
So I would say from each experience, right, I take different things that have
Yeah.
really built my career, right? So one thing about being around patients, either in the daycare setting that I was in
Hmm.
or as an EMT, you really understand what people are working with when they're face to face with patients every day, what their
Yeah.
focus is. So that experience has helped me understand the million things that clinicians have to do today. And then when an emergency comes and we're trying to communicate with them, having a little bit of that experience helps me craft communications a little bit better, or have different expectations for clinicians, meaning they might not be reading email all of the time. They might not have time to read paragraph upon paragraph upon paragraph of
Hmm.
something that maybe doesn't impact them, every moment of every day. So I really think that that helped shape, my communications and that aspect of emergency management. I think collaboration and teamwork in wildland firefighting, as well as at other jobs, way back when I was a telemarketer, and you're
Yeah.
still in a team there and you're understanding how to navigate when people are really angry at you, and how to kind of move through your script in different ways. And
Hmm.
so I really think that all of the different jobs that I have helped kind of mold me into this career now, which is uh, pretty fast paced, but also changes on a day to day aspect. And I think that perspective kind of helps me navigate those changes and try to get what needs to be done during a response completed.
Yeah, sure. I think I'm gonna go out on a limb here and I'm gonna guess that you're not much of an introvert. You're probably more of an extrovert.
No, not at all.
Would you agree?
Yes, yeah, I would say I'm like an extreme extrovert. I
Yeah.
need people, I feed off that energy, which is a good thing for this career for sure.
Yeah, and that kind of leads me to my next question is how has that been an asset for you, whether it's in previous roles or the role that you're in now?
I would say the majority of my job is networking in different ways. So
Mm,
if there's an emergency, I have to call a bunch of people, come together and figure out a response plan, what happens next. That's all based on relationships, it's all based on people, and it can happen at any time during the day or night. So, if you are a person who really gets a lot of energy from other people and it's 2 o'clock in the morning and you're paged and you get on a Zoom or you have to go into the hospital and see other people, that's where
hmm.
I get very energized and it really helps me wake up and say, okay, what needs to happen. Let's get people in and try to foster a nurturing environment during that time frame. So I'm lucky in that I found this job that matches that part of my personality of just kind of who I am.
Yeah, absolutely. And I think kids kind of train you for waking up
Yeah.
at 2 a.m. anyway, right?
Yes,
You're
that
ready
is
for it.
definitely true too.
You're like, I can function off no sleep, trust
Yeah,
me.
it's after kids, it's your whole barometer for tiredness just totally
It
changes. You're
changes.
like, oh, I
It
got 2 hours,
really,
it's fine.
I'll be
Yeah,
fine.
yeah.
Totally. Well, you mentioned that the environment that you're in now is it's very fast paced. Um, I laugh before I answer this question because I think I know the answer already. What does a typical day look like for you? Is there even such a thing?
I, like many other people in this world, a typical day looks like a lot of different Zoom meetings or meetings in person. So I would say that is typical to pretty much everybody, but
Sure.
what we're doing changes frequently. We
Hmm.
have a lot of regulations that we have to maintain. So it could be a planned project of updating different procedures or communications. It could look like a pipe burst, which happens unfortunately frequently. And we have to either evacuate a part of the hospital or
Mm.
bring together a group of people to understand what that looks like. Today we started the day with an active shooter training
Oh
that
gosh. Yeah.
both security and I facilitated. So it can look very different depending on the day, which I personally love. I find it really attractive to have different days and the ability to focus on things quickly, but also have, you know, a whole different topic that you're talking about at different points in the day. Some people hate it for sure, but that is definitely something I thrive on and
Mm,
enjoy. It keeps every day uh, interesting, and it also
sure.
helps me learn. Like I'm constantly learning in this job. There's always some weird shortage or something that I had no idea we could do clinically. And
Yeah.
I'm learning, what that means for us during an emergency, how to evacuate that population, or what that population needs when we do turn off the generator for a certain reason. So it keeps me really engaged for sure.
Yeah, that's great. I think I'm sure that gets easier with time, right? To like
Yes.
keep up with the pace. I can't imagine jumping into what that was like, right? To jump into an environment that's like there's constantly these new things happening and it's a very unfamiliar setting for you. So tell me about the early days of just getting started. How did you adjust to that type of environment? Obviously, it's comfortable for you now, but what was it like in the beginning?
It's an interesting environment. This hospital is great. We're number one in the country. We've got a lot of type A people together, working together. Everybody's got an opinion, which is a really great environment and because of learning and all the things that I talked
Of
about.
course.
It
Yeah.
is challenging to come into an environment like this. My first day, I came in as a manager, and I had three conflicting meetings at 8 a.m. the first day that I was here.
Fun. Great.
And
What
all
better way to get
on
started?
totally different things. It was kind of the time of Ebola. So, I
Mm,
had a biocontainment meeting, and then I had like a regulations meeting and a meet and greet with some high person. And I remember going to my supervisor who happened to not be around that day and emailing him being like, how do I manage three meetings at the same time? And that continued for a couple weeks for sure. The good news is I did have a really supportive group of people around me. I knew
Yeah.
the hospital from my previous position, so that helped a lot. And I will
Hmm.
say, for anyone starting a new job at a leadership capacity where potentially things are expected of you very soon, just hang in for like 6 months and like figure out what the culture is and like just keep going that 6 months, and then after 6 months you can kind of evaluate, is this for me, is this not for me? Sometimes
Sure.
right off the bat if it wasn't for you. I think the pace was aggressive when I
Mm.
started, and that kind of scared me a little bit, but I also really enjoyed the work. So I think it
Yeah.
was trying to, you know, wade through that environment and
Yeah,
understand
sure.
what this means to me and what this means to the department. And then I felt like, okay, it's my role. I can decline meetings. I can set my own schedule, right? Like, but when you start, it's a tricky environment because you're just kind of
Sure.
somebody else's role. So, uh,
Exactly.
but after probably 6 to 9 months, I felt like, okay, I think I can see what I can do here and what my role is and what this could be, which is great.
Yeah. No, that makes sense. My mom used to always say it takes a year to really get to know a person. I think the same can be said about a
So
job.
true. So
You got to
true.
hang in there. Don't give up.
Yeah, yeah. Don't get engaged within the first year, also.
Right.
That's
Exactly.
that is a
Agree.
different thing, but I'm just saying that's what my mother always said. And I was like, well,
Agree. Sometimes moms know best.
yeah, yeah.
Um, you mentioned, some of the requirements you have to deal with, things like compliance or, the planning, things that you're working on. How do you kind of balance all those different work requirements, and respond to those, I guess triaging different issues and just kind of getting through the aggressive pace of the day?
I would say the regulatory side of things
Hmm.
is actually helpful because it brings people together, and we can easily say we have to do this for compliance reasons.
Sure.
Um, it is very hard when there is an initiative by senior leadership or even the news, something pops up that
Mm,
is that everybody kind of gets excited about and wants training on or wants a different plan on. And it
right.
takes a while to develop those things. We have processes in place and structures, and when that happens and we're up on a deadline for regulatory action, that can be definitely stressful. I do rely on my team a lot to make
Yeah.
sure that they know what a priority is and what a priority isn't. When we have sprints, things that we have to do in a very short amount of time, we try to utilize that.
Yeah.
And I try really hard to delegate as much as possible, which I don't know if my team loves, but I try to hire really good people, and I really want to trust them and trust their expertise. And so
Yeah.
I'll always be at a meeting if they want me there. I hope that they know like what the direction is for certain projects. But I do rely on my team a lot to make sure that we can keep the projects running if there is something crazy happening that kind of brings me away from project work.
Totally. I think that kind of brings me to another question. When you were first getting started, right? So you're coming into a new role. You're kind of observing, right, in that first 6 months or so, what's happening, maybe things that need to be completely overhauled or things that maybe need some tweaks, what's working well, what's not. How do you find, what's your approach to that? Like how would you normally stepping into any new role, not just where you are now, but what is your typical approach to kind of figuring out, determining what's working well, what's not?
I think most important thing is to listen,
Mm,
right? So meet with your team, meet with the stakeholders and listen. Take a ton of notes, figure out, okay, why something is done the way that it is done. Might sound bananas, right? It might just feel like this, why is this done this way? This is so complicated. But if you take note of that, if you ask a bunch of questions, generally speaking, people have really good intentions for why they do something and when. And if you start to understand the process behind it, you'll at least know why they do something. Whether or
sure,
not you want to change that is a
sure.
different question, but it will help inform the way forward. And it also helps you understand how the organization works. So
Absolutely.
decision-making processes, who needs to be involved. Maybe they also think that this process is crazy, but the senior leadership thinks it works great and
Right.
you present it in a different way. So I would say listening and really understanding strengths and weaknesses of those who are around you before trying to change things, unless it's absolutely necessary, like a safety hazard.
Yeah. Would you say that's the one of the tougher challenges that you faced, or what would you say is the hardest thing you've had to work through in this role now?
I would say, yeah, the hardest thing is definitely navigating different changes at a, executive or senior leadership level during a crisis.
Mm,
So we have structures in place and we have processes and protocols that we utilize when we do have a major crisis. And then the executives also have very important priorities that we need to meet. So it's important to make sure that we have, a good working relationship, but also communication back and forth, and that we have the okay to do certain things when it is a huge emergency, such as COVID, or we've had some, security incidents. We need to make sure that we work closely together, but making sure we have that buy-in as well as that base time at a
yeah.
certain level can be really challenging.
Yeah. Well, I mean, speaking of big crises, you were there for major events like the Boston Marathon bombing. Um, how did experiences like that really shape your, I guess, overall perspective on emergency management?
Yeah, so I was at the city of Boston when there was the Boston Marathon bombing. My
Mhm.
role was to be the liaison between all the hospitals as well as police, fire, EMS. So it was extremely stressful.
Yeah.
We were activated for multiple weeks. I was
Yeah.
putting in 14, 16 hours a day and dealing with really heavy
Yeah.
issues, family reunification, as well as, dealing with some of the fatalities and some of the issues there. I would say anytime there is a significant emergency, I learn a million things about
Yeah.
systems, about communications, about how important it is to show up at different times. What I will say about the Boston Marathon bombing is really, I learned my limits at that point,
Yeah.
which was really,
Yeah.
really important at that stage. I was young and I really thought, I can do this, no problem. I will go forever and I can be up all night. I can be up all day. And,
Yeah.
you want me to do something,
Turns
I
out you
will.
can't.
Yes. And weirdly enough, I and everyone are human in different ways. And I think there was a time when somebody higher up at Boston EMS said, everybody who's working right now has to go see these trauma counseling people. And we went in and just talking to them and hearing them
Hmm.
with the other people that were around, we're like, okay, we need a support system. You need to back away sometimes for everybody's sanity. You need time to refresh, you need time
Yeah.
alone, you need time to reflect. And that is just as important as being on for 15 hours at a time. So I
Yeah.
think that that portion of knowing yourself is just really important in your career as well
Yeah.
as outside of your career.
Yeah. No, it's it's really important to take care of yourself because it's really hard to take care of other people when you're not.
More frantic. Nobody wants to work with you after you've been up for 24 hours. That's
No, you don't even
crazy.
want to be around
So
yourself.
yeah, you don't want to be around yourself. You're only eating Twixes and Kit Kats, and you're on your 15th cup of coffee. You're not making good decisions at that point. So
Exactly. For some reason, I can't stand Cheez-Its to this day because that was like a constant. And like a lot
everybody
of
has their thing that like brings them right back to like
like
their
no
sponsored crazy
no
time.
thank you. I'm sorry, Cheez-Its. They're never going to sponsor this podcast because
Yeah,
it's not my favorite. A lot of people, my kids love
never
them though.
again.
Never again. So I want to switch gears a little bit because you mentioned you've done a lot of hiring. You mentioned looking at people's strengths and weaknesses, and again, like you've learned a lot about yourself over this period. One thing that we talked a lot about was hiring, and there are so many people right now that are looking for jobs in this market. It's really important to stand out. Um, what makes a candidate when you're going through when you're looking for people, what makes a candidate stand out to you?
So I will say, we small, effective team here. There's six of us. So
Hmm.
every hire is a very important hire. We
Yeah.
work very closely as a team. Everybody on the team has to make sure that they approve of this person, who can work with this person. Frequently, you're going to be up in the middle of the night with this person. So we really want to make sure that the hire has the right fit,
Mm,
both the job as well as the aspirations to be there. One thing that's really important for me is to make sure that the candidate knows what the job is.
yeah.
This is tricky because emergency management is new. It's a new field. It was really born out of Hurricane Katrina in healthcare. So people will apply to the job for the emergency department and think that they are for a clinical
Uh,
role. And
okay.
so one thing that we do is really make sure that we read resumes and cover letters. This not everybody does it, but it is really important to our role to just to make sure that the individual knows what they're applying for
Hmm.
and has an idea of how their world, their strengths will also inform the team. When I create a team, I want a diverse population of people, of skill sets, of ambitions, because we do so many different things here. It's really good to build a team that, where not everybody is the same, which means I might not pick somebody who has previous experience in emergency management. So when I look at a resume, I'm really looking at the skills that they're
Mm.
saying that will attribute to something that I do. So if we're looking at communication or if we're looking at evaluation, I'm looking in between the lines, being really detailed about what they might bring to the team, like I said. The other thing I will say is proofread your resumes. I have seen swear words. I have seen
Yikes.
like things that I know they did not want me to see on when they uploaded their resume. And it's tough because I've been out there, I've been looking for jobs in the past, and you're just trying to get a job, right? So you're uploading resumes in different ways, you're writing a bunch of cover letters, all of that. But I will say just read it once beforehand, make sure that there's nothing in there because it really is your first
Impression.
representation of
Yeah.
yourself, right? That's your
Yeah.
first impression. So that would be, my 2 cents about kind of looking for a job in this environment.
I was going to say, what is the biggest mistake that people make? But I guess proofreading.
Yeah, I would say proofreading and also know the job, know if you really want that job, which is also really hard. I know it's hard right now because
Hmm.
there's so many people who are looking for jobs and applying to a bunch of different things, but frequently we'll bring somebody in and then we'll talk to them about the on-call role and they will say, "Oh, wait, I don't
No,
want
thank
to,
you.
I don't want to do that. And that's totally fine. I don't want
Right.
anybody on my team
That
who
doesn't want to
doesn't
do
want to
that.
do that, right?
Sure.
So it's important for a match on both ends. The person
Yep.
needs to want to do whatever is happening, and the job needs to fit that person. So yeah, that's what I
Yeah.
would say.
That's good advice. So what advice you mentioned kind of not needing emergency management experience, right? To be selected for a role. But what about people who are trying to make, whether it's into emergency management or otherwise, people who are trying to make a career pivot? What would be your best advice for job seekers in that situation?
Maybe this is my extreme extrovert talking, but I would
Sure.
say networking
Yeah.
is, especially if you want to pivot in that
Hmm.
role, things like lunch meetings or, hey, I want to hear about your role, and coming with questions and letting yourself kind of be known as interested in a career or a job that somebody you might not know has is important, because they're going to think about you when they do have an opening and
Sure.
say, okay, I do remember this person who really wants this job,
Hmm.
who might be interested in taking things in a different way, and you will kind of fall back on that relationship. So I think really just networking is really helpful, and putting yourself out there, which is hard too in this
Yeah.
day. Like nobody answers emails or phone calls,
Even for an extrovert, it
but
can be tough.
yes,
Yeah.
but it really does establish a connection, which might help you down the road.
Yeah, I agree. That's great advice. When you look back now on your career, and certainly you have years ahead of you, but at this point, when you look back, what has kept you motivated?
I would say the biggest motivation is passion in
Mm,
the mission and what I'm doing. So for me, it's really important to work in an industry and an environment where what I do matters in
yeah.
a certain way. So, we'll joke here and say we're doing it for the kids, and I don't see kids every day. Probably some of the regulations that I do don't, totally impact clinical care day to day, but for me, it really helps make long days, long hours, long nights worth it, to
Hmm.
know I'm doing everything I can to help the organization, which I
Yeah,
I believe strongly in.
of
I will
course.
also say having good coworkers, having an environment where you feel heard, having supportive leadership is also huge in a job. And I really think that that helps people stay
Yeah.
for a long time.
Yeah. No, absolutely. Um, what's next for you? Do you think this is your forever home, or
It's
could you
it's
imagine
a
doing
good
anything else?
question. Yeah, I really do. I do love this job. I would say, every now and then, especially during a bad winter storm or something, I'll think about buying an orchard or a vineyard and just living off the land and not having a pager or two cell phones. But for now, I think I'm here for a while at least.
I love it. Mary, they're so lucky to have you, and we've been so lucky to have you here. It's been great talking with you and learning more about the role that you're in. I think your team is really lucky to have you too. And for anybody who's out there who may apply for a job going forward in emergency management at Children's Hospital, make sure you're proofreading your
Yes,
resume. No cuss words, your resume.
it is true. Just read it once. That's all I'm saying.
I love it. Thanks so much for being here, Mary. It was great talking with you.
Thank you so much for having me.
And that's a wrap on this episode of Careers and Coffee Talk. Big thanks to our guest today for pouring out so many great insights. And hey, thanks to you for hanging out with us. If this episode gave you a little jolt of inspiration or made your day a little bit more brewed and balanced, be sure to click that subscribe button so you don't miss what's coming up next. Got a minute? Drop me a 5-star review. It's basically the podcast equivalent of buying me a fancy oat milk latte. Quick disclaimer though, the views expressed in this episode are personal and do not reflect those of any organization. This conversation is not an endorsement of any company, product, or service. It's just real talk over virtual coffee, okay? So until next time, stay curious, stay caffeinated, and keep chasing the career that makes you feel the most alive. Catch you next time.